Good morning, good afternoon, and good evening, everyone, from wherever you're joining us, and welcome to today's virtual demo, Warming Up for Success, Comparative Efficacy of Thermoregulatory Devices in Rodent Anesthesia. I'm Sydney Otamanchek from the events team at scientist.com, and I'll be your host for today's event. Our speaker is Dr. Atul Walunj, a technical resource scientist with Kent Scientific and a research veterinarian specializing in animal physiology. His focus includes technical support, product development for anesthesia and physiological monitoring, and outreach activities in lab animal science. Before I welcome Atul to present, I want to cover a few housekeeping notes to help you all get the most out of your experience today. First, take a look at the interactivity panel at the right of your screen with 4 tabs: chat, Q&A, polls, and handouts. We want this to be an interactive experience for you, so please send in questions, thoughts, and comments using the Q&A tab, and we will try to get to as many of your questions as we can at the end of the demo today. When a question is added into the Q&A panel, you can upvote the question to increase its position on my list by clicking a thumbs up button underneath it. This is always helpful so I know which questions to address first. You can also explore some links and documents in the Handouts tab to learn more. Lastly, if you're having any technical issues, please try refreshing your browser and ensure that you're using Google Chrome to access this event, as it is the most stable browser. If you're still having any trouble after you've refreshed, you can use the private chat function to communicate with me by sending a chat in to Sydney, and I will help you to troubleshoot. Just before we begin the presentation, we'd like to get to know you in the audience a little better with a couple of polls. So my first question for you today is, which type of general anesthetic do you commonly use in your animal research program? In this case, we just have 2 options. It's either inhalant or injectable anesthesia. So just let us know what you work with in your own lab, in your own facilities. And I'll just give you all just a couple of moments here to respond. And then we're going to move on to a second poll. And so I'm not too surprised by the results. Most people are using an inhalant anesthesia. Thank you so much for participating. Okay, and our next poll for this first part of the webinar, or of the demo: how long do you anesthetize your experimental animals for? So we've just got 30 minutes to 1 hour, 1 to 2 hours, 2 to 3, or 3 to 4 hours. So just let us know, again, what you perform in your own labs. Perfect. Already see some responses coming in. We will be running a couple more polls a little later into the presentation. So yeah, keeping this open for you all to answer. Okay, now let's not delay any further. I am excited to bring on our speaker, Atul. Good morning, Atul. Take it away.
Good morning, Sydney, and thank you so much for the introduction. Hi, everyone. Welcome to this presentation on thermoregulatory devices for supporting laboratory rodents under general anesthesia. So, following are the topics that will be covered in today's presentation, starting with rodent thermoregulation 101, as well as the pharmacological effects of general anesthesia, which will be the introductory topics for today's presentation. Next in line, we will discuss anesthesia-induced hypothermia, as well as its pathophysiological effects, which is the actual core theme of today's presentation. Moving forward, we will also discuss different body temperatures and how to monitor them using various monitoring tools throughout the perioperative period. Next, a major part of this presentation will be focused on the warming devices, wherein we will discuss the characteristics of an ideal warming device, which are the key points to consider for any new lab when they're shopping for a new animal warming system. The talk will then be followed with understanding the pros and cons as per the usage or applicability of various different types of animal warming system. And then the presentation will be concluded with discussion related to best practices in the perioperative duration based on recent trends in research related to rodent anesthesiology. For example, practices like pre warming or induction warming, which are not heard up till now, but have been quite well researched and established, and we can surely adopt them in our lab. All right, so starting with the rodent thermoregulation. Laboratory rodents like mice usually prefers to live in an ambient temperature that is usually around 4 to 6 degrees below their core body temperature at any given point of the day. For example, if the core body temperature of the mice is around somewhere 36 degrees, the preferred ambient temperature is around 30 to 32 degrees. However, in most of the vivariums, mice are maintained at an ambient temperature which ranges from somewhere 22 to 26 degrees. And this indicates that the mice are experiencing cold stress even before they undergo general anesthesia in a research program. The reason for such cool ambient environmental temperature in most of the vivarium is the human comfort. As you can observe from the diagram in the right hand side, you can see at an ambient temperature of 30 degrees, mice are quite comfortable at their thermal zone. However, humans with the PPE on, which usually work in the vivarium, have to deal with heat related discomfort. However, the situation completely reverses when the ambient temperature is changed from 30 to 20 degrees, where all the humans are comfortable, but at the expense of exposing the mice to cold stress. So, the overall keynote of this particular first slide of the presentation is that even before the animals are subjected or administered general anesthetic, they are experiencing cold stress, and that is why animal warming is very important. And over here, the best practice of pre-warming the animal will immensely help in bringing the animal in a normothermic range so that the animals are not stressed even before they are subjugated to anesthesia. Moving forward is the pharmacological impact of general anesthesia. In a conscious animal, the hypothalamus is the one that tightly controls and regulates the body temperature, and that is why also it is regarded as a thermoregulatory center of the brain, which uses majorly the three physiological systems as enlisted over here, that is the nervous, cardiovascular, and the respiratory system. It uses them directly or indirectly to maintain the animal at all times in a normothermic range of body temperature. However, the same animal, when undergoes anesthesia, these systems undergo a depression in terms of their cellular activity as well as in their functional activity. For example, when we talk about central nervous system, there is a dose-dependent depression in the motor reflexes, autonomic functions, as well as there is a delay in the sensory signal processing. So when we talk about what is delayed sensory signal processing, it means that the anesthetized animal is unable to instantaneously perceive the external ambient temperature and even its own internal core body temperature. Likewise, with regards to cardiovascular system, under anesthesia, the heart rate reduces, the cardiac output plummets, and thus the animal experiences hypotension. In the similar fashion, the respiratory rate also drops down along with the respiratory depth, and thus the animal experiences tidal volume. Specifically, when it comes to respiratory depression, whenever it happens during anesthesia, the animal is at a greater risk for developing hypoxemia. And this is why, if the pulmonary ventilation and physiological monitoring is not properly managed, the animal for sure undergoes and experiences hypoxemia, which is the most important or the most commonly seen anesthetic emergencies in laboratory rodent anesthesia. So, from this slide, we have understood that as part of the pharmacological impact of anesthesia, all these three systems majorly undergo depression in their functional activity. With that, we will understand what is the anesthesia-induced hypothermia, its mechanism, and the differences between inhalant versus injectable anesthetics. So, with that, all the general anesthetics we know exert hypothermia in the animal to a certain level. This is because the hypothalamus, when undergoes anesthesia, loses its tight control over the body temperature regulation. And with that happening, the warm core blood, which is usually restricted in normothermic conscious state toward in the core area of the animal's body, now gets redistributed to the peripheral areas. where the body heat gets majorly lost by radiation and conduction. This is quite significant because 80% of the body heat loss that usually occurs under general anesthesia is lost by the redistribution of the blood. Moreover, that the cool anesthetic gases, which is usually used in a high flow anesthesia system, also contributes to animal hypothermia by respiratory tract cooling. So all these three major factors that lead to substantial and quick drop in the body temperature. The first and foremost is the animal loses heat immensely at a very rapid rate. Second, the detection of the cold is decreased. And third, the thermogenic corrective actions are suppressed. So all these three factors results in quick and substantial loss in the body heat and thus drop in the body temperature. Moving on to the comparison with inhalant versus injectable anesthetics. So when we compare these two, the injectable anesthetics exposes the animal to a much severe hypothermia, and that's why the recovery period in injectable anesthetic is also pretty prolonged. Moreover, the duration of the active warming that is to be provided to the animal is also prolonged in case of injectable anesthetics. So, to summarize that, when we provide inhalant anesthesia to the animal, the hypothermia severity is lowered significantly, recovery period is shorter, and the duration of active warming, the support that is to be provided to the animal, is also shorter than compared to the injectable ones. These are key differentiating points that should be considered for a lab which is developing a new anesthetic protocol or revising the existing one, that it's always beneficial to opt for an inhalant anesthetic than compared to the injectable one. So here are the list of adverse pathophysiological effects which are usually observed in laboratory rodents. So before I talk individually on these effects, the most important thing to understand over here is that degree of these pathophysiological effects depend majorly on three factors. First is the severity of animal hypothermia, second is anesthesia duration, and third, whether or not thermal support was provided to the animal and when was it provided. Was it provided only during maintenance or was it provided maintenance at the induction period as well. So with that, the most common impact that's usually observed is the delayed recovery period, and it's because of decreased neuron metabolism and lowered MAC value. With that, in a similar fashion, the hypothermia that's seen in anesthesia also weakens up the immune system of the animal, making the laboratory rodents susceptible to future lifelong infections. It also contributes to cardiac complications such as cardiac arrhythmias and coagulopathies. Moreover, it has been demonstrated that anesthesia-induced hypothermia impairs the renal as well as the hepatic function, thereby contributing to the metabolic disorders and affecting adversely the health of the animal lifelong. It also contributes to poor tissue perfusion, and most importantly, it has been demonstrated that anesthesia-induced hypothermia leads to increased variability in research data, resulting in reduced data reliability. So with that, we know what is the major implications of hypothermia, that it's not just related to lowering of the body temperature, but it also has deeper and adverse negative effects on the overall health of the animal when we view it from the perspective of animal welfare. So, with that, the incidence of anesthesia induced hypothermia often goes undetected because of two major reasons. One is that the body temperature was not measured, or whenever it was measured, it was rather incorrectly measured. And therefore, monitoring of the body temperature, especially the core body temperature during perioperative period, is very critical to prevent animal hypothermia during anesthesia. So, two major body types that are usually monitored. First is the core body temperature, which is most important, and second is a peripheral body temperature. When we talk about peripheral, we can measure the skin temperature, tail, as well as the fur temperature. using minimally invasive to completely non invasive tools such as thermal imaging as well as infrared thermometer. In terms of core body temperature measurement and monitoring, the monitoring tools are somewhat invasive to minimally invasive. For example, rectal temperature, which is most commonly measured as part of core temperature, is the using rectal thermometer, or then we can also use the Right Time Junior as well as Physiological. These are the two products that can measure, record, and monitor the rectal temperature on a continuous basis. Then telemetry devices can be used for subcutaneous temperatures as well as ear and esophageal temperatures can be measured using their respective temperature probes. So, in terms to measure the core body temperature, rectal thermometer is most important, or the rectal body temperature is most important. And the second most important is the esophageal temperature, where the esophageal probe is brought down to the level of the heart to as to get the most close proxy to the core body temperature of the animal. So another important feature when we monitor the core body temperature using products like Right Time Junior or PhysioSuite is that they have an added advantage of working in various modes. For example, there is a pad only mode or there is an homothermic mode wherein the based on the feedback the system receives from the rectal temperature, which is measured on a continuous basis, the intensity of warming can be altered. For example, if the system records that the rectal temperature is above the set temperature of the animal, then the warming intensity will automatically be reduced to bring the animal at a stable preset temperature level. And that will work in both the ways if the temperature is lower or higher in both the ways. So, this is a homeostatic way or the homothermic mode of working, and this makes sure that the animal does not get underwarmed and nor even overwarmed. Moving forward with the characteristics of ideal warming device. So first and foremost is the ease of use. The animal warming system should be easy to set up and manage throughout the anesthesia duration. It should be portable and adaptable as per different animal sizes, animal species, as well as the experimental or the protocol demands of the setup. Next is the rapid heating capability. This is to ensure that the anesthetized animal is subjected to warming immediately and avoid any warming wait times. For example, you shouldn't be in a position just after the induction for the warming pad or the warming system to come to the set temperature with the animal is waiting to be put on the thermal support. So there should not be, um, the wait time should not be significant over a year. Next, we have consistent and uniform heat distribution. The warming system should ensure that the warming is consistent and is able to maintain the anesthetized animal at a preset or predetermined stable body temperature by effective thermoregulation. Next, we have deep tissue thermal penetration. The warmth that is generated from the device should be capable of reaching greater tissue depth for effective core warming without the risk of animal burns. And then we have temperature monitoring and safety, where it is preferred that the device or the system should monitor multiple body temperatures so as to allow real-time adjustments. It should be compatible with other physiological monitoring, imaging, and anesthesia systems, and should also not interfere in those devices. There should be pre-warming capability, which we will discuss in our subsequent slide. It should be adaptable to different anesthetics use, that is injectable versus inhalant. It should be, of course, cost effectiveness should be there, because if it is quite expensive, many of the labs would be hesitant enough to purchase them, and should be reliable as well. It should cause minimal interference or should not bring any confounding variables into your research data. That's very important. and there should be a window of opportunity for customization as per your research protocol. That means they should be compatible with various research data acquisition software, data collection, and retrieval in a user friendly manner. Moving on to the first and foremost device, that is the most primitive one, that is hand warmers or pocket warmers or thermogenic gel packs. These are inexpensive, readily available, convenient to use, they are portable, and can be quickly be activated either by microwaving them or by chemical based activation. So, moreover, their use is quite popular when for non invasive short term procedures. The limitation, however, for these pocket warmers or hand warmers is that they offer inconsistent heat output, um, and there is no control over the adjustment of the heat output, the intensity of the warmth that is provided to the animal. There is also incidences where there is no uniform warming of the uh, hand warmers. Sometimes, whenever we use these microwaving pocket warmers, there are chances that the exterior or the edges might get warmed uh, or extra warm, or and leaving the central portion pretty cool. So there is no uniform heat distribution, and thus there will be no uniform heat output or the warming of the animal. It surely cannot be used for long term because of limited heat duration, and if at all it is used for long term, you have to replace them. So, in that regard, careful monitoring is very important. And many of the research have also recommended if at all you have to use them, make sure that there is an adequate insulation between the animal and the pocket warmers or the gel warmers to prevent burning of the animal or any local burns. So, those are the disadvantages of pocket warmers. Next is the electrical heating pads. They are portable, reliable, and easy to set up and use. So some of the problems that you come across with pocket warmers get circumvented using electrical heat warming systems. For example, they have adjustable heating settings with increasing warming gradient to maintain the animal at a precise body temperature. You get more control with less variability. And the heating is also quite consistent because of uniform heat distribution in the heating pads that comes with electrical heating systems. There can be tailor-made approaches with these heating pads as well. Of course, whenever we use electrical heating pads, there is a risk of thermal injury or hypothermia. For example, these heating pads can interfere with the electromagnetic interference, and that's why they're not appropriate for use in imaging systems like MRIs or physiological recordings. They also have a poor heat penetration in the tissue and thus only warms the animal's surface superficially. And if they are used for long term, they have a potential for drying out the skin because the root of warming the animal is conduction and might dry the skin out and dehydrate the skin as well. So, just like the previous systems we discussed, we also require in this particular situation careful, close monitoring to avoid overheating of the animal. And these inappropriate settings can also lead to temperature related complications. For example, if there is any electrical impairment in the electrical heating pad, it might overheat the animal even without us knowing consciously, because the animal is not going to respond to burning or the overheating. So we have to be extra careful and check the testing or check the warming of the pad before we use it on the animal to make sure that they're working properly. Next is the circulating warm water pads. The advantages that comes with these pads is that they have a precise temperature control so as to provide accurate and maintain the animal at a consistent body temperature, which is set throughout the anesthesia period. They also offer uniform heat distribution because of the warm water that's circulated throughout the anesthesia within the pads. These can be used for various animals based on their size and species. For example, large sized rats can also be used. One of the major limitations which I forgot for pocket warmers is that since they are smaller in size, they cannot be used for rats, only for mice. So with that, this particular issue is not there when we use circulating warm water pads. And they have been specifically researched and found that these circulating warm water pads are quite efficacious in preventing anesthesia-induced hypothermia throughout the anesthesia duration or perioperative period. They are also user-friendly to use as they come with adjustable settings. However, they come with these limitations. That is, they are bulkier. There has been research where there has been demonstrated some significant variability between different manufacturing pumps. So we have to make sure that whatever the pump and the heating system that we bring in the lab in terms of the warm water circulator, we make sure that those pumps are of good strength in terms of their power output. They are a bit expensive than other simpler heating methods like heating pads and gel pads. The space requirement, of course, they use large space requirement, but that should not be a major limitation. The another limitation that I would like to point out is that these warming systems, although they prevent animal hypothermia, they are only efficacious in terms of surface warming of the animal, as their warmth is not able to penetrate deeper into the tissues. So one of the major checklist that has to be done, or the limitation that has to be done, is that you have to make sure that there is no leakage, there is no puncturing in the warm water circulating systems. Because if at all there is a leakage and the it's not checked before the anesthesia, it might create a problem during anesthesia. Moving to the FIR warming system. These are the far infrared radiation, which is a type of electromagnetic radiation within the infrared spectrum and is used in products like Right Temp and PhysioSuite, not just to deliver basic warming but also therapeutic warming. So FIR usually works by emitting electromagnetic waves that cause a tissue's water molecule to resonate, generating warmth within the tissue directly. So these warming effects also lead to local vasodilation, improving microcirculation, which helps in turn to deliver oxygen and nutrients to the tissues. So the increased microcirculation also promotes indirectly in tissue healing, muscle relaxation, and pain relief. One major advantage of using a fire warming system is that they have a deep tissue penetration ability. For example, 2 to 5 millimeters of radiation penetration can happen into the tissues, warming the skin, subcutaneous, and the further deep layers of the tissue. And the best advantage is that, unlike other traditional warming systems, which usually require that there should be an animal contact with them for warming by conduction and convection route, FR does not require that the animal should be in direct contact with them. So most of the advantages I've already discussed over here. The specific contraindication is that they cannot be used in specific metabolic or disease models such as brown adipose tissue metabolism, diabetes, and peripheral neuropathy. Moving to the best practices, that is a pre-warming of the animals to mitigate hypothermia. The concept over here of pre-warming involves that the skin temperature is increased by 4 to 5 degrees, thereby reducing the difference between core and periphery temperature gradient. This will limit the temperature redistribution and thus causing the blood redistribution to not happen during general anesthesia, thereby delaying the hypothermia subsequently. So, based on that, a study was recently published in 2020 where they had this hypothesis whether pre-warming in laboratory rodents will work or not. So they had three pre-warming groups. Uh, the first group was NW, that was no pre-warming, that which served as control. The second was PW40, wherein they increased by pre-warming the core temperature of the animal, that is rectal temperature, by 40 degrees. Then PW 1%, where the core body temperature was increased by 1% from the baseline. The baseline was around 37.2 degrees, and they defined hypothermia threshold as 36.9. So after pre-warming, they subjected all the groups to general anesthesia, with 5% isoflurane, which is quite standard. And over here, throughout the anesthesia, they did not provide any external warming support to the animal. They just wanted to see only by the pre-warming whether the animals are able to resist anesthesia-induced hypothermia or not. So with that, they identified that the control group underwent hypothermia within 7 minutes, PW group underwent hypothermia 19 minutes, and PW1 underwent hypothermia after 12 minutes. So which proves that it pre-warming can delay or prevent the preoperative hypothermia depending upon the anesthesia duration. And with that, if it can delay the hypothermia, it also prevents the adverse effects that comes with hypothermia on animal health and research data. However, there are certain unknowns that we do not know. We do not know what would be the effects of pre-warming and infectious disease or metabolic disorder rodent models. We do not know that if the pre-warming coverage is longer, will the duration of the pre-warming uh, be dependent upon the duration of pre-warming or not. For example, if we increase the pre-warming duration, whether the warming support or the coverage that was provided during anesthesia will it be longer or not? That means extending 19 minutes or not. And then, will the rate of heat loss be affected with surgical procedures with varying degree of invasiveness? Over here, they just subjected the animal to anesthesia without any surgery. But however, we know if we do invasive surgeries, there is a rapid heat loss from the abdominal or the core insides of the animal body via convection route. Next is the thermal support during induction, which is not usually talked about. We know that the entire anesthesia duration is divided into induction phase and the maintenance phase. And we know that all these physiological systems, that is CNS, cardiovascular, respiratory, thermoregulatory, undergo depression in a dose dependent manner in terms when, for example, if you're using inhalant, or for example, isoflurane. And we also know that the dose of isoflurane is much higher. The percent of isoflurane administered is higher in induction than compared to the maintenance. So, with that, the rate of heat loss is also highest in the first 20 minutes of anesthesia. However, we do not provide much of the warming support during the induction period. And the reason behind is that the induction period is the shortest, spanning from 3 to 4 minutes. We also have provision of maintenance warming, and that's why we do not provide warming support during induction. Moreover, there are not many available market available induction warming specific devices, and also the conventional warming devices. For example, you cannot put electrical warming pad into the induction chamber. So, for example, in that way, they are not user friendly to be used during the induction phase. So, with that, understanding what we are doing with hypothermia is that we are not actually preventing it, but we are rather correcting it in the maintenance phase period. In order to prevent it, we need to provide animal warming support right from the induction period itself. So, this study was recently published in 2024, wherein they did three of the major treatments. For example, the first treatment group in mice was there was the control group, there was no warming support provided to the mice during the induction period. Then there were other two groups wherein different warming support was provided during induction. For example, if you see the thermal chamber, which is actually the induction chamber that was built into the anesthetic system, and the third group is where the author used Ken Scientific's right temp FIR-based warming pad and just placed it on the induction chamber or below the induction chamber, and they warmed all the three systems. Of course, the control there was no warming, and then they measured and recorded the rectal temperature of the animal throughout the induction phase. So they observed that the control group, of course, as there was no warming support, entered hypothermia immediately. However, throughout the induction phase, both the groups, the other groups wherein the heating pad was provided and the thermal chamber was provided, they did not enter into the hypothermia. They were maintained in this shaded range of normothermia. So the drop in the body temperature with regards to the control group was around of an average of 2.8 degrees, which is significant in terms when we think about the thermoregulation of the animal. So with that, it is very important to adopt these recently researched practices such as pre-warming or thermal support during induction period as well, to make sure that you prevent animal hypothermia rather than just correct it, because the ill effects or the adverse effects will stream down further into the overall health of the animal. So with that, we now conclude our presentation for today. Thank you so much for listening to this presentation and being patient with us. And we will move on to our Q&A session. And please feel free to ask any of the doubts or questions that you have regarding the presentation.
Thank you, Atul. That was a really wonderful presentation. Just before we do start our Q&A session, I am going to launch those last two polls. So our first one for this next part, do you monitor the animal rectal temperature during the anesthesia period? So quite simple, just let us know yes or no. And while you are responding to that, I did want to draw your attention again to the handouts tab. There are some really great resources in there to help you learn more about the warming systems from Kent Scientific, as well as a couple of video resources that could be helpful for you. Okay, interesting. It's almost 50-50 for that one. So thank you again for participating. And our final poll for today's session is, are you interested in a functional induction chamber that would offer both pre-warming and induction phase warming? So again, just a yes or no question. Let us know your thoughts there. All right, and lastly, if you do have to leave early, I did want to pop up a link to our post-event survey. You can let us know your thoughts on today's session, as well as provide any feedback or any future topics you'd like to hear from us or the Kent Scientific team, and even populate your questions in there if you do have to jump off early before you can submit them. So without any further delay, let's get right into our Q&A session. Atul, I'm going to bring you back on camera here. Hello.
Hi.
Okay, let's see. Our first question for today, let me go through these. Would you expand on the comment about far infrared warming not being suitable for diabetic animals?
Yes, so there has been research done where they diabetic neuropathy. They found that using FR-based warming is not suitable for them, and for them, conventional warming is rather much appropriate because FR warming pad, as we know, it induces tissue thermogenesis by heating up the water molecules in the tissue. So it might interfere and bring a variable into the research group. So with that purpose, uh, the fire warming pad is not the best to be used in this particular research area.
Okay, thanks for expanding on that one. How effective are electric heating pads at deep tissue penetration? Do you have any information on that?
Yes. So based on our internal as well as customer support and also research data, we have seen that the electrical heating pads provide superficial or skin only warming. uh, they do not have deep tissue penetration. They can have it if you increase or crank up the heating setting. However, it will in turn cause local or superficial burns to the animal. So they can produce internal or tissue depth warming, but it will counteract with the way of local burns. So you do not want that. So there is no other way to provide in-depth tissue warming without preventing local burns. So, in short, the answer is that electrical heating pads are not the best for deep tissue warmth presentation.
Okay, perfect. Thanks for that explanation. Um, Towards the end of your presentation, you mentioned the pad temperature. So, what would the pad temperature be set to in order to maintain 37 degrees Celsius animal temperature without burning the animal?
So if we are talking in terms of the FIR warming pad, so the pad temperature should be maintained somewhere from 37 to 37.5 degrees. You can also have the homeothermic mode switched on where you have one rectal probe, one thermal probe into the rectum of the animal and the other on the pad so that there is a feedback initiated communication, um, and the warming intensity will be enough to maintain the animal in a stable normothermic temperature range. So usually it's near to the normal body temperature of the animal, that is 36 to 37.5 degrees.
Okay. And on that note, what is the ideal rectal temperature of an animal under isoflurane? Would it be those numbers that you just stated?
So under isoflurane anesthesia, of course, the rectal temperature will drop down right during an induction phase itself, uh, which is the actual issue, and that shouldn't be considered as the normal body temperature of the animal. With that, you already know that in a conscious state animal, the normal body temperature of the animal is in mice is like 36.5 to 37 or 38 degrees, and with rats it is a bit higher side from 37.5 to 38.5 degrees. So you have to make sure that you are in the mid range of the normothermic temperature range of the animal, and that's what the temperature should be preset in any of the fire based warming or electrical heat or warm water recirculator. So once you put that temperature, and make sure before even the anesthesia is started, the warming pad or the device is reaching that temperature, it should be fine. Once the animal starts to lose its body temperature, however, the animal is in contact with the warming support, the animal will again try to regain the warming from the warming device. So it's always a situation how early you make sure that the animal receives warming or not.
Okay, great. Can you let us know whether you should also warm the animals before inducing them, like when they're awake, and how long would you recommend beforehand?
That's a practice done at many of the labs. Usually, the animals that are set for general anesthesia or any surgical procedures, they usually bring them in the cages, and the cage is kind of warmed. So that's kind of a pre-warming. But over here, we would like to make sure that animals are not also subjected to much of the handling stress. So once you place the animal in the induction chamber itself should pre-warm the animal and make sure that the animal is not experiencing any cold stress that's usually seen in vivarium. So it would be great if we could have a product which works as a thermal chamber but also the induction chamber.
Okay. So this next question kind of touches on that. Uh, does the far infrared pad need to be in contact with the animals, not the housing cage or anesthetic chamber placed on top of the pad?
I'm sorry, I did not get that question.
I
So is
think
it,
I think they're asking whether the animal should be on top of the pad and not the cage or the chambers being placed on the pad.
so on a maintenance phase or when the animal is on nose cone, you can have the animal on the pad. That's what we would recommend. But many a times the surgical procedures require surgical drapes, but that's also fine. Having as thin as possible surgical drapes to make sure the pads remain clean and aseptic. Having surgical drapes will not create any issue in animal warming because as we mentioned earlier, there is no requirement of animal to be in direct contact with the pad, but we do require that whatever the in between material is used, like a plastic material or a surgical drape, that should be as thin as possible to make sure that the animal receives adequate warming as well in the same time.
Okay, perfect. Um, we have reached time. We did receive a couple of questions regarding the paper related to thermal support during anesthesia induction. Um, your questions will be passed on to the Kent team, so they should be able to provide you with that paper post event when we're finished here, whether a tool reaches out or somebody else from the team, but they'll definitely be able to help you, as well as any other questions we didn't get to with the time that we had. Atul, I want to say thank you so much. You did a really wonderful presentation. It was very clear, and I really appreciated your time with us today.
Thank you so much for the opportunity and for your time to allow me to present on this particular platform.
Wonderful. Thank you.
All right.
Okay,
Thank you so much, everyone. Have a good day.
perfect. Okay, and yes, thank you to our live audience. We know how busy your schedules can be, so we really appreciate you being here live, and I hope you enjoyed your experience. You can continue to submit your questions again in that post-event survey as well when the event closes here, and they will all be passed on to the Kent Scientific team. So if you didn't get your question answered, just please continue to submit. In closing, we hope that you enjoyed this Inside Scientific virtual demo produced in partnership with Kent Scientific, and I hope you all enjoy the rest of your day.